Welcome to Psych Prep Quiz, where we help you master psychology with DSM-5-TR-based multiple-choice questions and case studies. Today's quiz is on intellectual disability, so read the question carefully, choose the best answer, and let's begin. Intellectual disability is classified under which DSM-5-TR category? B. Neurodevelopmental disorders. Which combination is required for a diagnosis of intellectual disability? C. Deficits in intellectual functioning and adaptive functioning. Adaptive functioning includes which three domains? C. Conceptual, social, practical. According to DSM-5-TR, severity of intellectual disability is based primarily on D. Adaptive functioning. Which of the following is an example of a practical adaptive skill? C. Personal hygiene and self-care. When must symptoms of intellectual disability first appear? B. During the developmental period. Which severity level of intellectual disability is most common? D. Mild. Which condition commonly co-occurs with intellectual disability? B. Autism spectrum disorder. Which statement about IQ testing is true? C. IQ supports diagnosis but does not determine severity. The primary goal of treatment and support for intellectual disability is to C. Improve adaptive skills and independence. Which assessment is most important for diagnosing intellectual disability? C. Standardized intelligence and adaptive behavior tests. Which IQ range is most commonly associated with mild intellectual disability? D. Approximately 50 to 70. A child has significant limitations in daily living skills, but an IQ of 72. How should this be interpreted? BID can still be diagnosed. Which professional is most likely involved in adaptive functioning assessment? C. Psychologist using standardized scales. Hey, quick pause. If you're studying psychology, social work, or counseling, this channel is for you. We break down DSM-5-TR topics, multiple choice questions, and case studies to help you pass exams and actually understand psych. Hit subscribe so you don't miss new quizzes every update. Now, let's get back to the question. Which of the following best describes social adaptive functioning? C. Interpersonal skills and social judgment. Which condition must be ruled out before diagnosing intellectual disability? C. Normal cultural or educational differences. Which statement about intellectual disability across the lifespan is true? C. Adaptive skills can improve with intervention. Which severity level typically requires extensive support for daily living and communication? C. Severe. Which term replaced mental retardation in DSM-5-TR? B. Intellectual disability. Which approach is most consistent with best practice in supporting individuals with intellectual disability? C. Strength-based, person-centered planning. Which factor best distinguishes intellectual disability from a specific learning disorder? C. Global deficits in adaptive functioning. A child struggles only with reading and math but functions well socially and independently. Which diagnosis is most appropriate? C. Specific learning disorder. Which adaptive domain includes understanding social rules and avoiding victimization? C. Social. Which statement about cultural considerations in diagnosing intellectual disability is true? C. Clinicians must consider language and cultural background. Which cause is most commonly associated with intellectual disability? C. Genetic and prenatal factors. A 6-year-old girl has significant delays in communication, self-care, and social skills. Reliable IQ testing is not yet possible. Which diagnosis is most appropriate? C. Global developmental delay. A 7-year-old child with Down syndrome shows delays in reasoning, learning, and adaptive skills. Which diagnosis is most appropriate? B. Intellectual disability. A teenager with intellectual disability has strong visual memory and excels at routine-based tasks, but struggles with abstract thinking. Which intervention approach is most appropriate? B. Use strength-based functional skill training. That's the end of today's quiz. Count your score. Let us know in the comments how you did, and we'll see you in the next update. Bye for now, preppers.